namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Good afternoon, everyone. Thank you for joining us today at Dr. Hotze's Wellness Revolution. I'm Stacey Banfield, sitting here with Dr. Stephen Hotze, and Dr. Hotze is the founder of the Hotze Health Wellness Center. And if you've got any questions for Dr. Hotze today, he's live in studio. You can just pick up the phone and give us a call at 713-212-5950, or you can send us a note on Facebook. We are on Facebook right now, so all you have to do there is type in Hotze Health. That's Hotze Health, Hotze Health, and you can watch Dr. Hotze, not just listen to him on the radio program, and then also want to let everybody know that we have podcasts that you can download. All of our radio programs are available online, so easy to listen to them any time of day or night. All you have to do is go to hotzepodcast.com. That's Hotze podcast.com. And now, without further ado, we've got Dr. Stephen Hotze. How are you today, sir?
I'm doing terrific, Stacy. How are you?
Well, doing great. Well, one of the things we're going to be discussing today is why do people need a health coach? Why can't they just kind of, figure it out on their own? There is the internet, after all.
Well, you can go see your conventional doctor, let him figure it out, right?
And that's worked so well for so many people, right?
Well, we have a problem in the United States. We've got a lot of people alive who don't feel well, who don't feel alive. In fact, we have a lot of people alive who are sick and tired of being sick and tired. They're just that way. And they cannot find a solution to that problem. And they've tried conventional medicine and all its various pharmaceutical remedies, and they just don't get better. And I would say the reason this is the case, they don't get better, is because the current insurance, medical, industrial complex, this system is set up to generate huge amounts of cash for the pharmaceutical companies, the insurance companies, the hospitals, organized medicine, and the federal government. This is what is in the plan. So individuals or patients with chronic health problems that occur as we age, people aren't going to feel it 60 without doing something about it. Routinely at 50 or 60, you don't feel like you're 18, or even at 40, you don't feel like you're 18. But you can. You can feel like you're 18. Heck, I'm 67. I still think I could go out and play football with the guys at St. Thomas where I grew up playing. I'm serious.
You just have that
I'm in good shape.
energy
I have
level,
no problem.
right?
Put on the uniform. I go out and take them on.
There you go.
I'm serious
Take
about
on the
that.
world.
I don't have aches and pains. I've got energy. I got more energy than most of the guys half my age. And the reason for that is that I got on a health and wellness program early in life.
And you know what I love about that too, Dr. Hotze, is you talk about how your dad, once you got your dad up on the program, night before, well, first of all, getting him on the program extended his life.
Right.
For one. So all of those years, what kind of value do you put on that? Well, you don't. I mean, it's just
it's invaluable.
It's invaluable.
It's priceless.
It is priceless. You had all this extra time with your dad, all those memories, and then the night before he died.
The night before he
you
died,
asked him,
at 80 years old, I
Yeah.
said, Dad, how are you feeling? He said, son, I feel like $1 million. I feel this good since my food hadn't tasted this good since I was 18. So that's the way to live a life, to be full and brimming with energy. Now, because he had heart surgery years before, really 12 years before he died, he had catastrophic occurrence when he had angioplasty requiring emergency surgery, terrible damage to the heart muscle, and left him with congestive heart failure. And he wouldn't let any doctor treat him. His heart was as big as a foot. He wouldn't let anybody treat him. He would only let me take care of him. And I did. And I had to find out natural approaches to health, how to get him on a path of health as well as naturally. And it was my dad's adversity that got me onto the path of looking for alternative natural approaches to health to get him healthy. Well, he fired all his doctors, quit all his drugs, and he was supposed to have lived with all the drugs and everything he was on. He had a 1-year life expectancy with the disaster that had happened to his heart and should have never been able to get out of bed. Well, he walked 2 miles every day, and he worked and ran his manufacturing business till the day he died.
Oh,
That's just the way it was. So he took charge of his health and made me his coach. That's what he did. He made me his coach. I was his health coach.
Yeah, and it's an amazing story because, a lot of times the best things are invented when there's a need.
Right.
And you weren't even thinking about it until your dad said, okay, I'm firing all my doctors. Help me out here. And you're like, what do I know about vitamins, Dad?
What vitamins do I need to take, son? It's Dad. What do I know about vitamins? I'm a doctor. Well, now we have at least 150 vitamin products at Hotze Vitamin Store, and we ship all over the country and out of the country, our vitamins. So my dad's adversity. In my dad's adversity, there was a seed of equal or greater benefit.
And it's helped a lot of people.
Right.
But then the flip side of that is when there's a need, however it's used, like the pharmaceutical companies, they'll make up drugs that really aren't addressing the root.
The needs.
They see a need in the symptom.
Right.
However, they are making billions and billions of dollars of not actually curing people, just masking those symptoms.
Well, here's the deal. The medical, business, industrial complex that they've got in medicine with the insurance companies. So you've got the insurance companies, you've got the pharmaceutical companies, you have the hospital corporations, you have conventional medicine and the government, all controlling your health. Now, and telling your doctor how to treat you. You go, oh, my doctor treats me the way he thinks best. No, sir. That's not right. He treats you the way he's been instructed by the insurance company protocol to treat you. Whether he agrees with it or not, he's got to agree with it. So he has to rationalize that this is the best way, because if he doesn't follow the insurance company protocols, guess what? He's out of their protocol. He's out of their program. And then all the patients that have chosen him in that program can't go see him anymore because he's not in the program. And guess what? He loses his income. So guess what? Think of your doctor as a puppet and the strings are tied. He's got strings attached to him. He's got the strings of the insurance company. He's got strings of the medical establishment, which doesn't tolerate people that think out of the box. They've never, you go back medicine all the way back, they never, ever would accept unconventional thinking in medicine. Yet it's unconventional thinking that got us where it was. When old Pasteur came out with the idea that there were germs, oh my gosh, that's just the craziest idea in the world. There was such thing as germs, and he documented there were. When Ignaz Semmelweis, the OB-GYN doctor in Austria, said that the reason that women were getting puerperal sepsis is because the doctors weren't washing their hands between cases, and they'd go down and do dissections, and they'd carry staph bacteria up, and the women were getting, 25% of the women were dying of puerperal sepsis infections, and Dr. Semmelweis had them wash their hands, and they dropped down to 1% of deaths. But guess what? They hated the fact that he was right,
and they fired him,
and they threw him out. They ostracized
him.
Shunned. So this is the way it is in medicine. When you have a natural, safe, simple approach that goes against the medical paradigm, guess what? They cut you off. But we live to fight, and we live to fight on, and our goal is to help you obtain and maintain health and wellness naturally.
That's right. A huge part of our program is making you more self-aware so you're not a victim of the system. And if you want to find out more information about doing a 180 and taking charge of your health today, then call us, 281-698-8698.
Or call us on the program at 713-212-5950. I'd like to hear from some of you all about the experiences you've had with your conventional doctor.
You are listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Dr. Hotze's Wellness Revolution, your daily dose of radio reality.
If you are sick and tired of being sick and tired and want to do a 180 and take charge of your health today, then give us a call at 281-698-8698. That's 281-698-8698. Or if you want to give Dr. Hotze a quick call, we are live in studio. You can call us at 713-212-5950. That's 713-212-5950. You can also, reach out to us on Facebook as well. All you have to do is go to Hotze Health. That's Hotze Health. If you have any questions for the good doctor, And now here he is, Dr. Stephen Hotze.
Thank you, Stacy. Thanks for joining us on Wellness Revolution today. I believe that you need a health coach, and you know you do, to coach you on a path of health and wellness naturally. A physician and a staff of professionals, he'll coach you on a path of health and wellness naturally, so you enjoy a better quality of life as you mature. Without pharmaceutical drugs, you can't get well on pharmaceutical drugs. You will get sicker quicker because they're toxins, and they add to the toxic load that you already have in your body that's made you sick to begin with. So you need to consider investing in your health. Now, people ask, why don't you take insurance, Dr. Hotze? That's not fair. Well, you know why I don't take insurance? Just what I described in the first part of the program. You've got the insurance, medical, business establishment that controls medicine, and they will not pay anybody for natural approaches to health. They won't. You can't be on their program and do natural approaches to health because they don't approve of that. Now, why don't they approve of that? Because there's no money in vitamins and minerals and compounded hormones for them. They need pharmaceutical drugs that cost up to $50 or $100 a piece or more. That's what they get. And then you have to pay a massive copay. I got people that are on drugs. They're paying $500 to $1,000 a month on the drugs, and they're sick. They don't. I said, well, if you keep doing this, do you think you're going to get any better? You've been doing it for 5 years. Have you gotten better in the last 5 years? Well, my blood pressure's controlled. How do you feel? I feel sick and tired. Well, of course you do, because that's not the way to control blood pressure. Nobody has high blood pressure because they have low levels of antihypertensive drugs in their body. There's a cause for your underlying high blood pressure or any other health problem you have, and it has to do with your vitamins and minerals and nutrients. It has to do with your hormone decline and imbalance. It has to do with toxins in your system. It has to do with lack of exercise, poor eating. You're responsible for that. Now, you go, well, would I ever pay for it? I don't know. How do you pay for cruises? How do you pay for vacations? How do you pay for new cars? You pay with cash. You pay for it. You decide what you're going to spend your money on.
Well, that's a great point, Dr. Hotze. It's a choice. You choose to invest in what's important to you. If it's important enough.
Right. And if you don't think your health is important, you have no reason to be listening to this program. Really. You're wasting your time. Why would you care to listen to the program if you don't have any desire to take charge of your health? But if you have a desire to take charge of your health, let me give you a simple way that you can do that. Well, one is that you can defer other expenses and you can invest in your health, because if you don't have good health, my friend, you don't have anything. All wealth production and productivity is going to be based upon your health. If you're not healthy, you can't be productive at work. You may not be able to work. I don't know how many people we've seen, they got so sick they just couldn't work. What does that cost you not working? $50,000, $80,000, $100,000 a year or more?
There's always a cost.
There's a cost to that. What does it cost you to see your doctor every year? What does it cost you in copays? What does it cost you in copays, or what does it cost you for your drugs there? Add up the cost. Besides, what does it cost you not having good relationships with your spouse or kids or family or friends? What is the cost of that? Can you put a dollar amount on that? What about it when you don't feel good about yourself? What's the cost of that? Wouldn't you like to get up in the morning and go like, it's a great day. I'm going to make it a terrific day. I got more energy and I know what to do with it. I love being with my husband or my wife. Boy, I love my kids. I can't wait. We're going to go out and do great things today. I love my work. I love my job. I'm just excited about being alive. I'm enthusiastic. Wouldn't that be wonderful to feel that way? What is that worth? It's priceless. It's invaluable. So what you have to do is you got to make some choices. What am I not going to spend money on and defer gratification in one area so I can get myself healthy and well, so I can make more money, so I can enjoy my life more, so I can do all those things I want to do? Oh, my goodness. It's so simple. Folks, it's just this real simple concept. Here's something else you can do. You ever heard of health savings accounts? You can have a health savings account. You can take, and all of you should be saving money, put your money in your health savings account. It's a savings account. Health savings account. It's a savings account. And you save not with after-tax dollars. Routinely you have to save unless you have some kind of deferred plan. You paying taxes, and then you're setting aside savings after taxes. With a health savings account, you put your money in before it's taxed. And then you can spend that money on your health care. How's that?
Health savings accounts are incredible. It's such a great option.
And
There's just so many reasons why you should have one.
And if you don't have one set up, you need to talk to somebody at your company, or you need to talk to a wealth advisor or somebody.
I mean, it's basically your money. It's set aside
Right.
pre-tax, and then whenever you have anything with your health that you want to pay for, you can actually, it's like a credit card that's attached to it, so it's really easy. You don't even have to apply for reimbursement anymore. You just pay for it through your account.
I've been setting aside money, I don't know, for 10 years in health savings accounts, and we've taken very little out of that. Janie did cut her tendon, and we had to, cut a tendon with a knife, and we had to have that surgically repaired. We paid for it with a health savings account.
Yeah, it's nice to have that. And the other thing that's really neat about it too is if you wanted to still go ahead and pay for that, you could still hold on to the receipt. And down the road, if you wanted to take that money out, you could present that receipt at a much later date and still get your money back, and it would still be tax-free. So, I mean, my goodness, we could do a whole show
on health savings
accounts and how awesome they're. We do have a question on Facebook,
right?
One of our Facebook viewers. So this gentleman, Daniel, writes, I have begun taking vitamin C, lysine, proline, and fish oil to manage my high cholesterol that runs in the family. What is the ratio of C, lysine, and proline? Does C still work as well when taken with sugary drinks or D-ribose, or should this combination be avoided? So far, he says, I'm down 26 pounds.
Hey, you took charge of your health. What's his name?
Daniel.
Hey, Daniel, congratulations, my friend. You're taking charge of your health. You're doing a 180. You're getting on the right side of the health freeway. You're going to decrease your risk of the problems that are associated with aging, which are increased weight, pre-diabetic and diabetic, adult onset diabetes, high blood pressure, heart disease, kidney problems, degenerative arthritis, Alzheimer's, all of those things. You can keep yourself healthy and well by getting on a good, healthy lifestyle eating program, taking vitamins and minerals. I would add, Daniel, that as we age, your testosterone level is going to decline, and supplementation of that can be very, very helpful, as can some thyroid preparation if you have the signs and symptoms of low thyroid, which I believe anybody who has signs and symptoms of low thyroid deserves a therapeutic trial of thyroid. I don't care what your blood test says. 95% of the people are always going to fall in the normal, so-called normal range of lab values. So you never get treated except you get your symptoms treated. They label your symptoms as diagnosis. I call this labelitis. So anyway, you're doing good on that. Now you're asking the question, what's the ratio of proline and lysine? It's a good question. It depends on whether or not you have any calcification of your arteries. And that can be easily discovered by doing a heart scan. We offer it here at the office. You don't have to be a guest. You can call up and come and get a heart scan. I think it's $395 or $400 or I don't know, somewhere in that neighborhood. Come in and get a heart scan. Then you know whether or not you have any calcification of your arteries. If you do, you know you've got coronary artery disease, the primary cause of which is that you don't have adequate amounts of vitamin C in your coronary arteries because your arteries are degenerating from the toxic load that your body has. And the toxic load always affects the coronary arteries before it affects anything else. And when you get degeneration and deterioration of your arteries, your body should make collagen if you have enough vitamin C. If you don't, guess what? Then you have the backup mechanism. You lay down plaque, which is lipoprotein A, a form of cholesterol. You lay that down, and then macrophages come in and attack that. You get buildup in that area of your heart where it narrows, and you get calcification of it. And now if you build a plaque upstream from that and it flicks off, boy, it clogs up the artery. Next thing you know, got a heart attack. You've got to take copious amounts of vitamin C. I recommend you take it to stool intolerance. You could take 20, 30, 40,000 milligrams a day. I recommend 1,000 milligrams per 25 pounds of body weight to stool intolerance. If you get too loose of stools, you can back off 70%, 75%. So if you take 6 and you've got running stools all the time and can't control it, Back it off to 5. See how you do. Back it off to 4.
Well, I'm guessing with your talk about inflammation as well, that the sugary drink part probably wouldn't recommend
No,
that.
I wouldn't
that
recommend
increases
that at all. I'll
inflammation in
come
your
back
system.
and finish this up, talking about proline and lysine when we come back.
That's right. And so Dr. Hotze was talking about that heart scan. You can get that down here at the Hotze Health and Wellness Center. You do not have to be a guest, and all you have to do is call 281-698-8698 to get that scheduled. That's 281-698-8698. You are listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Why walk amongst the living sick when you can join a wellness revolution? Here's Dr. Hotze.
Thank you for tuning into Dr. Hotze's Wellness Revolution. This is Stacey Banfield here with Dr. Stephen Hotze. And if you would like to do a 180 and take charge of your health today, then please give us a call at 281-698-8698. That's 281-698-8698. We'd be more than happy to give you a complimentary health consultation as well as a complimentary copy of Dr. Hotze's best-selling book, Hormones, Health, and Happiness, and a copy of his latest book, Do a 180. Join the wellness revolution. Do want to remind everybody as well that we do have podcasts available for downloading. So you can go to hotzepodcast.com. That's HOTZE podcast.com. Lots of great radio shows, all labeled, very easy to find what you need, and then you can download them day or night. So really appreciate everybody who's already been downloading those. So definitely check out that site. And then, of course, we are on Facebook right now. So you can go to Hotze Health. That's HOTZE Health. And you can just watch Dr. Hotze on the show. Don't necessarily have to listen to him. You can watch him as well. And then you can also post a question. In fact, Dr. Hotze was just addressing a question from Daniel in the earlier segment. I think he's going to get back to that in a moment. But do also want to make sure that you are aware that you can not only call us, but you can post questions. More than happy to answer them that way in the social media world that we live in. And then, of course, you can always do the old-fashioned way. You can pick up the phone, pick up your smartphone, and call 713-212-5950. That's 713-212-5950. And you know what? I have a little bit of my dignity left. Our producer was playing around with the graphics. So if you were on Facebook, if you were watching the show at the very end of the last segment, you would have seen some silly stuff. I'm glad he's got that out of his system because he's just been dying to embarrass us. So thanks a lot for that. And now here's Dr. Stephen Hotze.
Yeah, Bill Simpson is a practical
He
joker.
is. I didn't think he was going to do that for real. And then
He's a practical joker.
now I know what I look like with cat ears. Thank you, Bill.
We were talking to Daniel. Daniel had called up to brag and to boast and to be proud. And I'm proud of you for having lost 26 pounds, got on vitamin
awesome.
C, and hope you're on magnesium as well. Vitamin C, you should take 1,000 milligrams per 25 pounds of body weight. Weigh 100 pounds, take 4,000 milligrams. 2,000 in the morning, 2,000 in the evening. If you weigh 150, take 6,000. If you weigh 200, take 8,000. And divide it in, 4 in the morning, 4 in the evening. Okay, just divide your dose. Also take magnesium. And by the way, if you get stool intolerance, and you can back off 75%. And see how you do on that. Then also take magnesium. Magnesium is look, vitamin C first is critical and important. It lowers cholesterol. Did your doctor ever tell you that it will help you lower cholesterol?
I never heard that.
Oh, my goodness. You mean I could use that instead of statin drugs? Oh, it also is important for thyroid function and for the utilization of thyroid hormones and the manufacture of thyroid hormones. Oh, guess what? It also helps your body repair your coronary arteries by helping your body make enough collagen to heal the arteries when they're inflamed. And inflammation is what causes coronary artery disease. When you have coronary artery disease and you don't make enough collagen, which is the protein that is the glue that holds together your cells, when the lining in your arteries begins to deteriorate, your body's going to make collagen. If it can't make enough collagen at that point because it's under stress, and in that part of no matter how you look otherwise, in that part of your body, you've got low amounts of vitamin C necessary to make adequate amounts of collagen. Your body's got to produce more cholesterol because it's got to start using Band-Aids to patch the deteriorating arteries. The body doesn't like that. It's a compensatory mechanism to help heal the arteries. Unfortunately, it has unintended consequences over time. It can cause the hardening of the arteries because those plaques of cholesterol assimilate calcium. They begin to narrow the arteries, and you get other plaques build up. And if you flick off a plaque, or if an area where you have atherosclerosis, some of the blood vessels within the atherosclerotic plaque burst, then it can lead to hemorrhaging within the artery, and it can lead to clotting, and then you get a heart attack. So you want to get rid of the inflammation. The best way to do that is to take vitamin C. Now, proline and lysine are both very important in the production of collagen, as well as to help your body reabsorb and take out of the plaques the calcium. So if you had coronary artery disease and calcified plaques, let's say you ought to take 5,000 milligrams of proline a day and 5,000 milligrams of lysine, 2,000 milligrams of proline. Otherwise, you could take 2,000 milligrams of lysine every day and 1,000 milligrams of proline, and that will help you. Also, K2, vitamin K2 helps get rid of the calcium in the arteries.
And he was asking about fish oil as well.
And fish oil is important. And fish oil is important because it keeps one thing it does, it keeps the blood thinned out. So it easily, it doesn't clog up as easily. So does vitamin C. It helps with your blood flow, with the clotting factors in your blood, so you don't have a hypercoagulative state where you're making clots and they're clogging up your arteries. So, but it's also very important for the omega-3 nutrients. These are omega-3 oils that your body needs, particularly your brain. So fish oil is very important for brain function, and it will help you tremendously with your ability to think. You need that good oil in your brain. You need good oil in your brain, and fish oil is a great way because it has, and I use myself cod liver oil, a tablespoon a day, and I take a teaspoon or two of the fish oil product that we have down there in the pharmacy. So I'll make sure I get plenty of that. So anyway, we're back to where were we after we were interrupted by this question?
Which was a good question.
By the way, if you've got a question, you can either go to your Facebook Live page, type it in, and we'll pick it up, or give us a call. As a matter of what I really want to do is hear from you on those of you that have been, are sick and tired of being sick and tired. And most people, first thing they do is they're going to go see their conventional doctor. That's why, because you got insurance and you paid for it.
Sure.
Something's paid for, and you go, well, I'll just go see what my doctor has to say. And unfortunately, your doctor was trained like I was, to think of symptoms when blood tests are normal as diagnoses. Symptoms are not a diagnosis. If you've got high blood pressure, that's really not a diagnosis. That's a symptom of an underlying problem. The question always should be, what's causing my high blood pressure? Or we should ask ourselves, what's causing my my joint pain? Or what's causing me to be overweight? What's causing this? What's the underlying cause? When we come back, we're going to talk about some of the underlying causes.
That's right. So if you want to comment on that, maybe some of the experiences you've had at the doctor's office, then just give us a call at 713-212-5950. That's 713-212-5950. Or you can go to Hotze Health, Hotze Health, and log in your questions and comments there. Thank you for listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Now back to the Wellness Revolution. Here's your host, Dr. Stephen Hotze.
Welcome back to Dr. Hotze's Wellness Revolution, where we are on a mission to help you achieve health and wellness naturally. If you want to do a 180 and take charge of your health today, then give us a call at 281-698-8698. That's 281-698-8698. You can also give Dr. Hotze a call today, 713-212-5950. Any questions you may have, or maybe any experiences that you've had with your physician where you felt like you were not being listened to, or maybe you were being offered pharmaceutical drugs and you knew that was not the answer for your symptoms. And you can also go to Facebook, go to Hotze Health, Hotze Health, and you can log in any questions or comments there. And then finally, we've got our podcasts. Want to make sure people check those out at hotzepodcast.com. That's hotzepodcast.com to check out all of our radio programs, and you can listen to them any time of day or night. Now, I do want to mention Dr. Hotze did spend some time talking about various supplements, especially vitamin C, and the various health benefits that they have. I must say, when I heard that vitamin C was a collagen builder, I bought myself some bottles, and I have been taking them religiously ever since. I love vitamin C. Well, at Hotze Vitamins, we stand behind all of our products and exceptional quality. We hold ourselves to the highest standard. So I did want to encourage everyone to go to HotzeVitamins.com if you want to get some vitamin C or some of the other supplements that Dr. Hotze was talking about. You can also get a complimentary consultation with one of our certified nutritionists, which is a great benefit also, because I have been one of those people who've gone into a vitamin shop, vitamin store, and I've been completely lost and confused because there's so much. You get overwhelmed very quickly. But a certified nutritionist is so helpful, can help you get what you need. So you can either call Hotze Vitamins at 800-579-6545, or you can go to HotzeVitamins.com, place your order there. And I would be remiss if I didn't mention this amazing special that we're offering with the Power Pack, which is our foundational product. That Power Pack will give you that boost of energy. It does have vitamin C in it. It does have fish oil in it. It does have our energy formula, which really does work. It's rather something. So what we're doing is if you get put on the what we call like an auto refill program, then you will get $60 off each shipment, which is extremely generous. So please be sure to ask them about that. And again, all you have to do is go to HotzeVitamins.com. Here we have Dr. Hotze.
Thanks so much, Stacy. Thanks for joining us on Health and Wellness Revolution, where I believe that you need a health coach. You need a doctor and a staff of professionals to coach you on the path of health and wellness naturally so you enjoy a great quality of life. So you're enthusiastic, vital, full of energy, vibrant. People look and say, boy, that's a live wire right there. When you like people to be talking to you about, boy, that's a live wire. Well, she's got more energy or he's got more energy than, if we could bottle that and sell it, we'd make millions of dollars. Well, that's the way you want to feel. No reason you shouldn't feel that way. I'm 67. I'm full of energy. Went out this last Saturday morning with a buddy of mine. We went out pheasant hunting. Killed a lot of pheasants, shot a lot of pheasants.
I saw the pictures.
It was great. It was a great deal. And then after that, we played golf. So it was a nice day. It was a nice day off. Recreate.
And yet even that takes energy. I mean, pheasant
Sure
hunting,
does.
That takes energy.
Playing
golf all day on the golf course. I would imagine for a lot of people, just that one thing would be enough. And then you just go off and then you go golfing.
Yep.
Lots of energy.
I was with my good buddy Paul Lewis, and I appreciate his friendship, and he's a great competitor and a great fellow hunter. We had a great time. Okay. One of our guests here, or one of our listeners, has said that they've tried 2 different kinds of magnesium, but their stomach doesn't like it. Well, why don't you try taking it with food?
Well, that's an answer.
Try that. See if that doesn't work. We recommend either magnesium glycinate or magnesium citrate, not the oxide, magnesium glycinate or magnesium citrate. You can also take it. There's oral magnesium, liquid magnesium that you can take, which we carry in our pharmacy. And you put a teaspoon in a glass of water, stir it up, drink it, you'll be fine. Or put it in a glass of lemonade. Not lemonade, but orange juice. Drink it, you'll be fine. And you want to make sure you get plenty of magnesium. Most Americans, 80% of Americans, are low in magnesium. And magnesium is so critically important for the production of energy within your power cells, within the cells, your power cells, which are your mitochondria. You've got to have magnesium. Magnesium helps relax smooth blood vessels. It helps with cardiac arrhythmias. It's very, very important to good health, and I highly recommend that you take that. Also, it'll help promote good bowel function. Remember when Grandma used to take her milk of magnesia? Remember the old commercials on TV? Those are my age. If you're having problems, take a tablespoon of milk of magnesia. Nature's way. Now, that's what it was. It was the natural way to improve your daily constitution. And so that was a very popular item. I guess it's still sold. I don't know, but it's magnesium in there that helps promote bowel function. So does thyroid. So does vitamin C. And you want to make sure you got good bowel function. And you shouldn't have any problem with having several constitutions a day. Keep yourself clean as a whistle. That way you keep from prevent yourself from getting colon cancer. Many Americans are constipated. They think a normal bowel function is every 3 to 4 days. Well, you can imagine what that does to the inside of your intestines. It's not healthy. I'll tell you that. And it can breed a host of problems, not least of which is colon cancer. So anyway, that's the deal on magnesium. So in this program, we've talked about the reason many people using the conventional model of medicine don't obtain nor do they maintain good health and wellness naturally. Why? Because conventional medicine does not take natural approaches to health. Why doesn't it? It seems safe. I mean, you can take vitamin C till the cows come home. You're not going to have any problems. You might get loose stools, but you're not going to die of vitamin. Nobody's going to die of a vitamin C intoxication or magnesium. My gosh, your body just excretes it when you got too much of it. It's natural. Your body needs those products to function naturally. Those are part of the biochemical mechanisms. They require these various vitamins and minerals and nutrients for your body to function well. I mean, that's scientific. That's just plain basic fact. So why would you could potentially restore your health naturally, why would you resort to putting in chemicals that never existed before in nature and which your body's never had them before? Why would you put those in your body?
You know, it's a great,
I don't understand. I really
it is a mystery.
don't understand that, how people can buy into this idea that I can take a toxin, a chemical drug, a pharmaceutical drug, which is a toxin, I can take that and that will make me well. Now, there's no question these drugs will treat your symptoms. They can lower your blood pressure, but the side effects, oh my gosh, you get on a beta blocker. How many of you on beta blockers just feel worn out and tired? Well, guess what beta blockers do? They adversely affect the beta receptor in your cells where the thyroid hormone has its action, and it subverts the natural utilization of your the action of your thyroid hormones. So you can get on all these beta blockers, lower your blood pressure, no question about it, but you also can't think clearly. You're tired all the time and fatigued. Or you're taking statin drugs and your body aches all over. You don't feel well. You're groggy. Plus, you're losing coenzyme Q10 because it's poisoning the system that makes coenzyme Q10, which your heart and all your cells need for good energy production within the mitochondria. It poisons that. It poisons the system that makes it. Anybody that's on a statin drug, for crying out loud, you ought to be on coenzyme Q10, 200 to 400 milligrams every day. That's just standard. And if your doctor doesn't tell you that, you ought to find a doctor who understands the adverse effects of statin drugs, which we don't use, by the way, and we get people off statin drugs and lower the cholesterol naturally. So what you need to do is you need to take charge of your health. I've been on a soapbox on this for decades. Take charge of your health. Do a 180. If you don't do it now, when are you going to do it? You can wait 6 months. You can wait a year. You can wait 5 years. Wait till you have a heart attack or you got cancer. Oh, then you're going to get, I got to take all these vitamins. I eat right, lose weight, and I'm going to get myself well again. Why wait till you get to that point? Why don't you do it now so you can enjoy your life besides preventing these unnecessary and preventable heart problems to your body? Why not do that? That's my question. You answer it.
Well, it's also, it just brings up the point of how important it is to have a health coach, Dr. Hotze, because people can have the best of intentions. They can say, I'm going to get well, I'm going to lose this weight, I'm going to do this by such and such a date. But if they don't have any kind of a coach to help them out, then they are less likely to get that done. And that's what we offer here, is that coaching, that lifeline. It really is so important to do that. So we would really highly encourage you to just give us a call for a complimentary consultation. We'd love to be able to serve you and to help you. All you have to do is call 281-698-8698. That's 281-698-8698. Well, it's a pleasure to have you visit with us every day. We love getting feedback from you all. Have a blessed and wonderful day.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.